and romance. And so the lips. Why do we kiss each other? Because there's this highly sensitive area here where we can exchange emotional feedback. And so that's why your lips get numb first, just so you know.
Okay.
But your whole face will be more than numb enough here very shortly.
So how many treatments typically does one get?
So we recommend all the best clinical studies about microneedling. Microneedling, by the way, is the treatment that is the forerunner of microchanneling. Microneedling came into vogue over the past 20 years via aesthetic doctors who were laser guys. Des Fernandez and Cameron and Doucette and who's the other guy? I don't want to forget. Anyway, the early clinical studies were all about using needles to damage the dermis in order to initiate a wound healing cascade. So microneedling has been popular for, popular for about a decade, but it's been around for about 20 years. And so in the past, we all assumed that the mechanism of action was damage to the dermis because that's what we do. Aesthetic practitioners and laser people, that's what we do. We damage skin so that we can get it to rejuvenate. And so all the best clinical studies are based on at least 5 treatments over the course of 5 or more months, 5 to 6 months. And so we recommend a series of, at our clinic in Denver, we have a package of 3 you can buy or a package of 6. And we recommend the package of 6 if you really want to experience the full benefit, the full clinical benefit.
So if somebody is looking to really smooth the lines around the mouth, for instance, a package of 6 is the way to go.
Definitely. You're going to definitely need 6 for wrinkles.
Okay.
Some fine lines, just overall laxity, tone and texture, by the way, pigmentary irregularities.
Hyperpigmentation, that's the big question.
Hyperpigmentation, you can start seeing noticeable results really for just overall laxity, tone, and texture. You'll see results after the first treatment. And that's what's wonderful about this, is that you get into it and you start to see immediately that your skin looks better, and you won't only see it, but your friends will see it, your family will see it, your sister-in-law will see it, your cousin and your aunt, they'll ask you what you're doing. And that's great. That's what everybody wants people to ask, why do you look better?
Yeah.
And so microchanneling will give you that instant gratification. Over a series of 6 treatments, you can experience the full benefit, which include increased stem cell activity, increased cytokine release, a thickening of the skin, both the dermis and the epidermis, but not an unhealthy thickening that we might experience due to our environment, where we have an overabundance of corneocytes, dry, dead, heavy cells. This is going to be thickening of the dermal layer as well as the keratinocyte layer, those healthy underlying cells, so that our skin will be softer, more flexible, and better able to resist environmental damage, contamination, irritation, and premature aging. A thicker epidermis is healthier. It provides better barrier function. It reduces sensitivity, and it also hides underlying imperfections like flushing, telangiectasia, rosacea. All these vascular irregularities can be better concealed by a thicker, more robust keratinocyte layer, an epidermal layer. And so that's what we will be able to experience here.
And we would recommend using the stem cell serum at home, correct?
Absolutely. We are constantly fighting inflammation on one level or another. And so one of the advancements that has occurred recently in the science of cytokines is the identification of both inflammatory and anti-inflammatory cytokines. So the cytokines we'll use here, this is a light molecule hyaluronic acid, along with a stem cytokine array that is weighted toward the anti-inflammatories. And the post-care that we'll recommend to Lori, which was right here, but I'm not seeing it. The post-care that we'll recommend is also oriented toward an anti-inflammatory balance of cytokines to help fight inflammation. And so there it is. the post-care that
The
we'll
post-care,
recommend. And this is
yeah.
just a little sample. And if Laura likes our post-care, you can get the full 1 ounce size. That's a 4 to 6 week supply. This is going to be about a 7 to 10 day supply that's going to help you to recover from the treatment, okay? And just so you know, we have a cytokine serum and a cytokine accelerator. The serum has a high concentration of anti-inflammatory stem cytokines. The accelerator has the same stem cytokines and CoQ10 and hyaluronic acid, and really a who's who of all the best skincare products on the market, along with some lipids to help avoid evaporation and a little bit of retinol to help with penetration. The serum goes on first to get the high concentration of stem cytokines. The accelerator goes right over it to prevent evaporation and to enhance penetration. And so, before we started, I should have told you that we need a towel, hot towel.
Oh.
But I did not. And so I will figure that out right now.
Do you need to? Is it to remove?
Just to remove the residue.
There are some new sponges up there if you want to run them under the.
You got sponges and water?
Well, the sponges in water, and there's new sponges right here, if you would like those.
Sponges and water work.
Oh, so they are right there.
Perfect. Lovely. How you feeling,
Lovely.
Laura?
Are you numb? Your mouth is numb? Is
Yeah.
this numb?
No.
That's not numb?
How's she supposed to know? If it's numb, she can't feel it.
Well, this is true.
I've always found that question fascinating. Do you feel numb? The proper answer would be no.
No. I don't know if I'm numb.
And so we're just numb. We're not going to use not like going to the dentist and getting an injection where you're going to be numb for the next several hours. This numbing will last about an hour, and it's just enough to take the edge off the microchanneling treatment.
Yeah, when Jada had this treatment, she couldn't feel a thing. And I think it was about half an hour after was when she started to experience the numbing dying off.
And so all of the numbing elements, the benzocaine, lidocaine, tetracaine, those are all down deep at the dermal epidermal junction. And we're just taking off the residue, which was the carrier of the product. And we just want the skin to be nice and clean.
Should somebody feel extra sensitive, maybe around the lip or the forehead, can we reapply the numbing cream?
You certainly can. You can also do pre-numbing if someone's really wimpy or if they tend to be hyper sensitive.
Okay.
You can have them pre-numb. You can put this numbing cream on for up to 45 minutes before treatment.
Oh, okay.
Alcohol, we're just going to disinfect really quickly here. A little disinfecting pass. We want the skin to be perfectly clean before we begin applying microchannels in order to deliver our product. Now I want you to take a deep breath all the way in, all the way out. Okay, now one more breath all the way in. Hold it. Now through your nose, just gently exhale. There we go. And now just don't forget to breathe. Just keep breathing, okay? And so we're going to start, Lori, okay? Mm-hmm. So we massage for about 5, then we chit-chat for 5, maybe 10 minutes. You can use that time to just chat with your client about whatever. I've used it to obviously talk about the treatment, but you guys could be talking about the life and the kids and the job and the move and the traffic and the weather, whatever. Just an opportunity to just be friends and talk. So the stem cytokine solution comes in a little roll-on, and this ampule is designed to be Lori's own ampule. And so we apply. And now we're going to deliver using our multi-channel tool. And first, what I'm going to do, Lori, is I'm just going to introduce you to my little friend here, okay? You ready? Mm-hmm. Okay, I just want you to see how it feels. How was that? Be okay? Okay, so I did that in the slow speed. Now we're going to go into full speed, and we're going to start to treat in earnest here. And so the microfilaments on the microchanneling head are perforating the epidermis. They are insulting the stratum basal. And they are delivering the stem cytokines and the hyaluronic acid. So Lori's getting a deep hydrating treatment along with stimulation in order to activate the power of the stem cells.
So if somebody had super dry skin, I have clients who cannot, there's no amount of hydrating creams we can put on that relieves the dryness. This would be a good treatment for them too.
Absolutely. And over time, we can, through the application of cytokines and the improvement of the cellular matrix, we can help improve barrier function, which will help retain more hydration, and we can improve sebaceous gland activity so that the oils that keep the skin moist and supple will be better regulated. And so now that we've delivered, we're going to take advantage of our open channels. We're going to reapply. By the way, how did that feel, Lori?
Nothing.
Great. So we're just going to now take advantage of those open channels, apply more of the hyaluronic with the stem cytokines, and then we're just going to move on to our next treatment zone. And then we'll begin again to microchannel. The actual time on tissue of the treatment is relatively short. And the end point is just a mild erythema, mild edema. And there can be a few little flecks of pinpoint as we insult the DE effectively. Every once in a while we may nick the dermis. The object is to just ride that DE and create a little bit of edema and a little bit of erythema.
Which is redness and swelling for those who
Which is redness and swelling.
are not familiar.
And you all know what happens when you injure yourself. The very first thing that happens is redness and swelling, because the inflammatory response is the first step in the wound healing cascade. The wound healing cascade, by the way, is extremely sophisticated. It goes on, in some cases, for up to 1 year. A wound healing event can last up to 1 year, depending on the severity of the injury. This mild insult is going to create a wound healing cascade that's going to last about 4 to 6 weeks. During that wound healing event, Lori's stem cells are going to release an array of cytokines, these proteins that are involved in wound healing. At the beginning, some of them are inflammatory, designed to kick off the inflammatory response and get everything ready for wound healing. Then there are the acute inflammatory growth factors. Then there are acute inflammatory growth factors. Then there are chronic inflammatory growth factors, chronic anti-inflammatory growth factors, anti-inflammatory growth sustainers, anti-inflammatory growth directors.
So there's a whole cycle.
A whole cycle, and during the release there can be a number of, even dozens of different cytokines that we've identified so far that are being released and utilized by the cellular matrix that we have insulted here. We haven't really damaged it, we've only insulted it. We've gotten it angry, but we haven't actually broken it, which is revolutionary. In the past, we thought we had to break it, damage it. We had to damage the fibroblasts. We had to damage the dermis. That's what we thought. But that's really not necessary, because stratum basal is a stem cell layer. It's a biosignaling layer. Through insult, mild insult, and very little damage at all, we can induce the exact same response that in the past. We used deep needling treatments, even laser treatments, even ablative treatments, radiofrequency treatments in order to damage the tissue. And so the wound healing event that we've kicked off here will last anywhere from 4 to 6 weeks. And during that cycle, by the way, the cellular matrix that's been injured or insulted is programmed to activate the appropriate receptors for the appropriate cytokine. Cytokine is kind of like a tool or a key. The receptors are sort of like a keyhole. And different cytokines are going to be expressed at different times, and different keyholes or receptors are going to become active at different times. And the immune system is programmed to know exactly how to do this. And so we're going to introduce cytokines over the next 4 to 6 weeks during that wound healing event that are just going to augment the cytokines that Lori's body is able to produce. Because Lori, I have some bad news for you. Your stem cells and your cytokines are as old as you are. They're no longer robust. They're no longer pristine. At least not the way they were when you were 18. And so we want to make your immune system behave like it was 18 again, and we do that through the introduction of pure, robust cytokines. Higher quality tools.
When would we schedule her second treatment?
4 to 6 weeks.
Okay.
And I'm of the opinion that you could do this every 4 to 6 weeks for life. Because
Okay.
again, our body is constantly experiencing some form of inflammation, and we are constantly fighting one degree or another of premature aging.
What indications do the skin give to let you know that it's too soon for a treatment?
And so we can really only base that on our knowledge of the wound healing cascade and how long it lasts. And so at the beginning of the wound healing cascade, we have the inflammatory cytokines, and then the inflammatory growth factors, then the anti-inflammatory sustainers and directors. At the end, we have growth inhibitors, because something has to turn that wound healing event off. Because the wound healing event, by definition, involves cellular mitosis, division. And we certainly, that has to stop at some point, because uncontrolled cellular division is not healthy. It's called cancer. And so while we want to augment the growth factors, and in our industry, the growth factors have tended to get all the glory, because, well, we're trying to rejuvenate skin, growth factors must be what we need. What we need are all the cytokines in the array, in order, released upon the skin. We need all the different cytokines present, so that when the receptors or those keyholes become active, they can access not only Lori's cytokines, but also the high-quality, pristine, robust cytokines that we have developed in the laboratory. They're just more, they're more perfect than our aging bodies are able to produce. You feeling okay, Lori?
Can you do the chest?
We can do the chest, we can do
Okay.
the neck, we can do the hands, we can do the elbows, we can do the knees, we can do hair regrowth.
Okay.
We can activate follicles, hair follicles that have been rendered dormant because of alopecia, which is a hormonal imbalance. And that's why most older men and women are losing their hair, is because of alopecia. And you can pretty much treat anywhere on the body where there's skin. And you can see we're using a stamping technique. We don't want to drag these needles across the skin, because that would cause unnecessary damage to both the keratinocyte layer as well as the dermal layer. And what we want to do is stimulate that wound healing event with as little actual damage to tissue as possible. Because the object here is to harness the power, the wound healing power that we have, but to refocus it on skin rejuvenation. And so the more damage we do, the more of that wonderful power is going to have to be focused on actual tissue repair. And we want to minimize that.
When you have a system that you need to move around the skin like that, doesn't that cause tears in the skin?
Well, not if you stamp.
That's what I'm saying. The one that you
The pens that you drag on the
because
skin.
I've used them where you drag around the skin, and I
Right.
didn't like them.
Right, and they're causing, not that they're bad, I'm not going to say they're bad, but they're just, they're yesterday's technology, back before we understood fully the mechanism of action. I don't know if you folks on Facebook can see, it's just a nice pink a mild erythema that we have going here. And that just tells us that we've initiated that wound healing event because we see the inflammatory response. And it's easily observed by the practitioner. It's very easy to see when the inflammation has started. Okay, now we're going to turn you this way. And we're going to move on to our next treatment zone. You feeling okay, Lori?
Mm-hmm.
Very good.
On a scale of 1 to 10, 10 being super uncomfortable, where would you put this?
3.
Okay.
And the forehead's about the worst part, Lori.
Yeah.
So it's all downhill from here.
Downhill in a good way.
Yeah, as far as discomfort.
Yeah.
All the discomfort is downhill.
So this is like a 2.
Okay.
And so there's no magic number of passes or no magic amount of time you want to spend doing this. We're just going to keep passing over the skin with this stamping technique until we observe the redness and swelling. So the skin will tell you when you've reached your end point. And it's typically anywhere from 2 to 5 passes. And the actual time on tissue of the treatment typically varies anywhere from 10 to 15 minutes. And so once we observe that pink, that beautiful pink response, then the skin will have told us that we have achieved our end point. And again, we're going to take advantage of those open channels with our hyaluronic and our stem cytokine delivery. And we go back over all the zones that we've treated because those little microchannels are still open. And there's already a nice improvement to the quality of the skin. That excited fibroblastic activity is producing an immediate volumization that's going to give Lori a little bit of instant gratification. People are going to notice even today that her skin looks just firmer, tighter, a little bit healthier.
Now the LED light therapy is a nice way to follow this up, correct?
Absolutely. Red LED is going to reduce inflammation. Blue LED can kill any bacteria because in our environment there are bacteria constantly trying to invade. So blue and red light and orange light as well are all very effective in enhancing the result.
So in the packages that I've put together for you ladies, you get a free LED treatment with each microchanneling. So if you buy a package of 6, that's 6 LEDs. If you buy a package of 3, that's 3 LEDs.
That tickled.
Tickling is good.
And now above the upper lip here. And again, we're just going to continue to flood the zone, all these open channels. We're going to apply our stem cytokines in the light molecule hyaluronic via this roll-on applicator. And the object, we're going to try to use all this up on Lori during the treatment.
Now this is most women's problem area around the mouth. Is that painful or is it tickling?
Tickling.
Okay, people, is tickling.
So the numbing cream is working really well.
Sorry, tickles.
And so we're going to open up these fine lines.
This is the best response to the lip you could possibly have. It
Oh,
tickles and she's
absolutely.
giggling.
Have not had a better response. So once we observe some redness and swelling, and a little bit of giggling can be thrown in. That's certainly not a
Giggling
bad
is
thing.
good. It's allowed.
We're fully on okay with giggling.
Can we go over the actual lips?
You can go over into the vermilion border where the Where those lines and wrinkles, those fissures in the skin are invading into the vermilion border of the lips. And now we'll just finish up on the nose. Again, we're going to continue to flood the zone. We want to get all this hyaluronic and all the cytokines, which again, you may have heard them called peptides, you may have heard them called growth factors, but they're all part of this family of proteins called cytokines that our stem cells produce in response to a wound healing event.
You can already see here an improvement. I'm sorry.
You had mentioned that it helps even if you do have acne.
So we have had anecdotal reports over the last 2 years from dermatologists and others of dramatic remission of even active, even cystic, even nodular acne. And so we are right now recruiting practitioners to put together some case studies around what is exactly happening with active acne, because the standard practice now is never treat an inflammatory condition with this type of treatment. But because this treatment involves a minimum amount of inflammation and then immediate control of the inflammation using anti-inflammatory cytokines, it could be that microchanneling is going to change the rules when it comes to active acne, cystic acne, nodular acne. So case studies are probably going to take us about a year. And right now we're recruiting practitioners who want to participate and provide some case studies. So it's exciting to think that we may have found a way to treat acne without drugs.
So if you're a practitioner out there and you'd like to take part, contact Doug McBurney.
So then what about blackheads?
So even blackheads, even long-term, what are called, a blackhead is a cystic legacy of acne. And so all of these conditions are inflammatory, and they are a response to, again, we're constantly fighting a couple of things: inflammation and P. acne. P. acne is one of the most common bacteria in the world. And if you had a fluoroscope and you could look at your environment, you'd probably never leave the house if you could realize how much of everything is always covered with specifically P. acne bacteria. And so, while in the past we've hesitated to treat an inflammatory condition with a treatment that actually induces inflammation, the level of inflammation we've induced is minimal, and the active application and introduction of anti-inflammatory cytokines, it's frankly something we've never done before without damaging the skin. In the past, with microneedling, we've damaged the skin, so the dermis even, so microneedling would be contraindicated for an inflammatory response, because when you lyse dermal tissue, you have a long-term inflammatory response. We're insulting the stratum basal and perforating the epidermis, which is a very short-term, low-level inflammatory response. Enough to kick off the wound healing cascade, enough to activate and excite the fibroblasts, but not a long-term inflammatory response that could produce long-term irritation as well as post-inflammatory hyperpigmentation. We haven't had any reports of PIH when microchanneling is done properly. So now just a little bit of hyaluronic acid. We have utilized all of the ampule so that the cytokines and the hyaluronic there are all infused. And now just a hyaluronic to clean up any tiny little pinpoints we might have. We want to make sure that those are calmed down and removed. And this is going to give Lori a little bit of hydration as well.
It does look good. I told you. That's why I was so excited when I found this treatment.
Well, all of us in our house can use it for different reasons.
So aside from some very specific contraindications, there's hardly anybody watching whose skin would not benefit from utilizing the power of your immune system to resist premature aging. Because when you look at the human body and the human immune system and the structure of the skin, we really should not be aging this quickly. There's something wrong. And so when we can harness what your body is programmed to do in order to defend itself and intensify and direct that energy towards skin rejuvenation, well, we've got a treatment here that is going to help resist all the signs of premature aging. Fine lines, wrinkles, pigmentary irregularities, vascular irregularities, everything that's associated with the unnatural state of inflammation that we're all experiencing every day, and the frankly unnatural state of premature aging that we're all trying to fight.
And the earlier you can start this, I have clients in their 30s who don't necessarily have a lot of visible aging, but if they started now, they're ahead of the game.
Think of it as preemptive treatment. Because the structure of your tissue, even in your 20s, the structure of your tissue is beginning to be undermined by our harsh environment. So anything we can do to build up and make our skin healthier and more able to defend against premature aging and our harsh environment is going to make your skin look better for the long term. So start in your 20s if you can, because your mom didn't.
Yeah.
But you can, because this just wasn't around when your mom was your age. So, and so that's it. Now, did you? We can certainly do an LED right on top right now while we still have a very mild inflammatory response. We could introduce the LED, and that could even bring it down.
You have time?
Oh, yeah, I'm sorry. Yeah, you're
Okay.
asking me? Yeah.
I can't film and do this at the
I'll
same
take the
time.
camera.
Okay, there you go.
Multi-purpose. Here we go.
My hand was cramping.
There we go.
We have the mark.
So a nice textural improvement, even immediately after treatment. A lovely textural improvement. And that's just going to get better over time.
So, we need to balance this on some pad.
So I do nothing with my face tonight, just let it...
You are good.
Nothing tonight. In fact, I wouldn't even wash you shouldn't even wash your face. So your body is programmed to work through this wound healing event.
Okay.
And that involves a desquamation of some tissue, and just allow that to happen, because since nature is designed to do it, if we allow it to happen, we can hopefully harness all the power you have in order to rejuvenate your skin. And we're going to get some LED going here so that we can now... And by the way, the inflammatory response that we've induced is very mild, and we believe that everything you can do now to squelch and reduce and turn off that inflammation is beneficial. Because we really only need that inflammatory response at the very beginning. After that, inflammation is generally not a good thing. So we'll use some red LED in order to reduce even further the inflammation so that you can get the best result you can while preventing the necessity of your immune system to fight that inflammation. We're going to bring in some tools. We brought in the cytokines already, and now we're going to bring in some red light LED in order to further reduce and eliminate that inflammatory response that kind of kicked everything off here. Oh, there we go.
So this may rest on your face, but that's fine, as long as it's comfortable. Is that okay? Alrighty. There you go. That's the picture.
That's awesome. So we're here at Billy Cordery's. Tell us, how do we get in touch with you, Billy?
Okay. Emma Glow Skincare in Conifer, Colorado. You can call me on 720-343-9582, or you can go to my website, myinnerglowskincare.com. I'd be happy to give you any details. My lovely client Laurie, we're going to post some photos in the next following day so you can all see how she does. We've already seen some great movements just in the one treatment right now, so I'm excited. And Doug McBurney is from Mountain Coastal Distributors. If you'd like to contact him, your number is...
Well, I'm at 303-489-9203. Or just Google Mountain Coast Distributors. Google Mountain Coast Distributors. Be happy to show you, if you're a skincare practitioner, about the new revolution in skincare that's all about stimulation, not about inflammation. It's all about instant gratification and long-term clinical benefit. The device is called the ProCell Therapies. Makes the device as well as the stem cytokine product. Be happy to tell anybody about that. And hopefully, Billy, you'll be getting some calls and some inquiries very soon.
I already have people lined up, so we're good to go.
Fantastic.
Right.
Thank you, Lori.
Thank you, everybody.
Here, we'll sign off with Lori. She's giving us a thumbs up.
Feels great.